On Thursday afternoon, the first vaccines had started to arrive in different parts of the country, carried there on RDF helicopters, and in the southern province, more than 19,000 were delivered to the districts of Huye, Gisagara, Nyaruguru, and Nyamagabe. District hospital vehicles then took them to the different centers the vaccination exercises are to take place. Huye residents say the COVID-19 vaccines are a welcome relief.
I'm very grateful for this initiative because the coronavirus pandemic has caused us many problems, negatively affecting the society. Students were no longer going to school and problems were piling up. Now that we have a vaccine and things will be going back to normal, we can thank God and the people responsible for doing this.
Some people were saying they cannot trust those vaccines, that they could be using people as guinea pigs to see how they perform. But I personally believe a vaccine is a blessing, seeing how Corona had virtually colonized us. It would help us get back to work and develop. Hospital administrators in Gisagara district have given assurances that the vaccination exercise will go smoothly. I can assure you that these sort of vaccines are properly tested before being approved for use, and people should not be worried. While Rwanda may be among the first African countries to get this vaccine, countries elsewhere in the world have been using it extensively and their vaccination programs are almost over. Local residents should therefore not be worried, and as doctors we will be close by to assist if any problems do arise.
In
Rubavu district of Rwanda's western province, the vaccines were received by health officials and kept in cold storage facilities at Gisenyi's hospital. They did not stay there long though, because before the day had ended, they were being distributed to health centers ahead of the vaccination exercise set to begin on Friday. The vaccines are now in cold storage here at the hospital, but they will not spend the night there because we are going to get them to health centers so that tomorrow morning the vaccinations begin. The exercise will last 2 days countrywide, tomorrow and Saturday. The health centers also have cold storage facilities for the COVID vaccines.
As nurses, we are ready to vaccinate our local residents and know them well. To start, those working in health centers will be vaccinated, then people with non-communicable diseases. Everything is ready, with cold storage for the vaccines and the necessary personnel to carry out the vaccinations.
Locals in Rubavu say getting vaccinated is particularly important for them, what with the district located on the border with the DRC and frequent crossings necessary for them to do business. We are happy to be vaccinated because it means we will no longer be afraid that this virus could kill us. Also, it could mean that the borders will soon be opened again and we could begin doing business as usual again, the way we did before, because the way things are now is very different.
This will help us. Now that a vaccine is available, we will be able to sell our goods freely again, with no restrictions.
Staying in the western province, vaccines arriving at the Kamembe airport were taken to the Gihundwe and Mibirizi hospitals, with each receiving 5,000. In the northern province, 40,000 vaccines were dropped off at the Ruhengeri hospital before being distributed to different vaccination sites. The vaccination teams both in the hospital and health centers have been trained. The vaccination centers are ready, and all that was left for us was to get the vaccines, and now they have arrived. I can therefore see no reason why things will not go well. Provincial authorities in the north are calling the vaccination program a milestone in the fight against COVID-19. We are very happy because our people have been waiting for the vaccines, hearing of vaccination programs in other parts of the world, and our president had said everything possible will be done to get them to Africa, and it has now been accomplished. Here in the northern province, we will begin vaccinating people on Friday, and as more come in, we will continue vaccinating local residents and call on them to respond well. when called to be vaccinated. And even though preventive measures will continue to be respected, at least those vaccinated will have more confidence that they will not fall sick easily. Nyagatare district in the eastern province saw the arrival of more than 10,000, while Kirehe got 8,559.